Hey everyone, and welcome to Health is Wealth. My name is Aaliyah, and I'll be your host today. In healthcare, we're trained to prioritize others, our patients, colleagues, our community. But in doing so, we often neglect one of the most essential elements of our own well being: sleep. Medical students, dental students, nurses, doctors, dentists, we've all been there. The late night charting, the all nighters before exams, the overnight call shifts. The CDC reports that healthcare workers are among the most sleep deprived professionals in the United States. Yet, we rarely discuss how this impacts us and the people we care for. Today, we're going to explore why sleep isn't optional. It isn't a luxury. Sleep is a biological necessity, and honoring it is a part of our ethical responsibility as healthcare professionals. So, let's go over a few things first. Sleep is a normal body process that allows your body and brain to rest. Despite how simple it sounds to sleep, it's actually a very complex and mysterious body process that we're still trying to figure out. Sleep is not passive. It's an active, highly regulated biological process guided by our circadian rhythm, the internal clock that regulates how we feel awake and when we feel tired. While we sleep, the brain cycles through non-REM and REM stages. These stages perform essential functions like tissue repair, emotional processing, hormone balancing, immune maintenance, and memory consolidation. But healthcare work often forces us out of sync with this internal clock. Rotating schedules, night shifts, late night studying, and charting under bright screens, all of these suppress melatonin and confuse the body's natural timing system. Even short term circadian disruptions affect cognition, performance, and emotional control, all crucial in clinical care. I also want to mention sleep affects almost every type of tissue and system in the body, from the brain, heart, and lungs to metabolism, immune function, mood, and disease resistance. Research shows that a chronic lack of sleep or getting poor quality sleep increases the risk of health problems like high blood pressure, cardiovascular disease, diabetes, depression, and obesity. I wanted to show you guys this great illustration. When our internal biological clocks, our circadian rhythm, is properly synchronized, our bodies and minds function optimally. We stay alert, our metabolisms work normally, our cognitive performance, immune system, cardiovascular system, all are supported. But when the clock is disrupted due to shift work, irregular hours, late nights, insufficient sleep, the consequences are wide ranging. From poor sleep and mental health decline to metabolic disorder, cardiovascular strain, insulin resistance, and more. This isn't just about feeling tired, it's a systemic breakdown that affects our whole body. As healthcare workers, understanding this difference isn't academic, it's practical. It affects our health, our learning, and crucially, our ability to care for others. All right, so we're going to move on to sleep and memory. But before talking about health consequences, there are a few major points we need to address, especially for students and clinicians who are constantly learning. Sleep isn't just rest, it's a part of the learning process. Sleep and memory share a complex relationship. Getting enough rest helps you process new information once you wake up and after learning. It can consolidate this information into new memories, allowing you to store them in your brain. So, why is sleep so essential to consolidation? Possibly because sleep seems to offer optimal conditions for consolidation, providing periods of reduced external stimulation, and increased levels of neurotransmitters that promote communication between the hippocampus and the neocortex. During deep sleep, the brain consolidates new information from lectures, clinical rotations, procedures, and studying. Sleep may also give the brain time to make space for new memories by reducing or removing the strength of neural links tied to memories that are no longer useful. When you learn something new, the best way to remember is to sleep on it. That's because sleeping helps strengthen memories you form throughout the day. It also helps to link new memories to earlier ones. You might even come up with creative new ideas while you sleep. All right, so let's look at the health effects of chronic sleep loss, which is something healthcare workers experience daily. Sleep deprivation means you're not getting enough sleep. For most adults, the amount of sleep needed for the best health is 7 to 8 hours each night. Sleep deprivation is not a specific disease. It is usually the result of other illnesses or due to life circumstances. Sleep deprivation is becoming more common. Many people try to adjust their schedules to get as much done as possible. I'm someone who does that. And sleep is sacrifice, which I do personally sacrifice my sleep to get school stuff done. A crazy fact that I even found, according to the CDC, one night of sleep deprivation reduces psychomotor performance. Being awake for 17 hours is similar to having a BAC of 0.05%. Listen to this. Being awake for 24 hours is similar to having a BAC of 0.10%. That's past the legal limit. Isn't that insane? Sleep deprivation disrupts metabolism, increasing ghrelin and lowering leptin, which influences hunger and satiety. Insulin resistance rises, blood pressure climbs. Beyond physical health, sleep deprivation impairs what we rely on most in healthcare: attention to detail, clinical judgment, reaction time, communication, and empathy. For surgeons and dentists, fine motor control is affected. For physicians and nurses, diagnostic accuracy drops. This isn't just about feeling tired, it's about compromised patient care. This diagram gives great visual overview of how sleep deprivation affects the entire body, not just our energy levels. Starting at the brain, even short-term sleep loss impairs judgment, memory, creativity, and emotional regulation. That's why we see increased irritability and stress, and why clinical decision making suffers when we're tired. In the muscular system, lack of sleep slows reaction time, decreases accuracy, and increases aches and tremors, which is especially important for anyone performing procedures or on hand clinical tasks. Moving to the heart, sleep deprivation raises heart rate and blood pressure and increases long term risk of heart disease and stroke. These are major concerns not only for the general population, but especially for healthcare workers under chronic stress. The lungs can also be affected, with higher risk of respiratory issues and chronic lung disease over time. The pancreas becomes less effective at regulating blood sugar, increasing the risk for type 2 diabetes. In the gut, poor sleep compromises immune function and disrupts digestion, leading to inflammation and gastrointestinal problems. Even the colon is impacted, with an increased risk for colonic inflammation. What this image really shows is that sleep deprivation is not isolated. It sends ripple effects through every major system of the body. This is why prioritizing sleep is essential, especially in healthcare, where cognitive sharpness and physical precision really matters. All right, so now we're going to talk about ethical responsibilities. In healthcare, we have an ethical obligation to maintain our ability to provide safe and effective care. Fatigue is not a personal failing, it's biology, but ignoring it can create risk. A tired dentist has reduced fine motor precision. A fatigued resident may interpret results wrong. A nurse working a double shift may have slow reaction times. Prioritizing sleep is not selfish. It's part of practicing competent, compassionate, ethical healthcare. All right. So I want to talk about a lot of people's secret weapon to staying awake, caffeine. I personally drink a lot of caffeine, especially right now with finals next week. I am trying to optimize my day. I got to use every hour, all 24 hours right now. And of course, healthcare workers often rely on caffeine to push through those long shifts. Caffeine works by blocking adenosine, a neurotransmitter that builds up in the brain throughout the day. Adenosine is like an internal pressure gauge. The higher the level, the sleepier we feel. Caffeine basically prevents your brain from registering that fatigue. And it contributes to sleep debt, which is the difference between the amount of sleep someone needs and the amount they actually get. For example, if your body needs 8 hours of sleep per night, but you only get six, you have accumulated 2 hours of sleep debt. Your brain keeps track of this imbalance, even if you try to mask it with caffeine. Every hour of sleep you miss adds to that debt, and caffeine often tricks us into thinking we can push through without consequences. But here's the problem. Even when caffeine makes us feel alert, the brain is still functioning at a deficit. Cognitive performance, emotional regulation, reaction time, and memory consolidation, they all remain impaired. And even if we continue using caffeine to cover up the sleep deprivation, the sleep debt grows deep. For clinicians and students, the cycle is dangerous because caffeine can make us feel mentally sharp even when we're experiencing the same neurocognitive impairment as someone who's legally intoxicated. So, while caffeine is helpful, let's be honest, it must be strategically used. Otherwise, it can contribute to the very problem we think it solves. So now that we understand the biology, the risk, the learning impact, and the role of caffeine, let's talk about what we can do about it. To give us practical, realistic strategies for improving sleep in healthcare, I invite a special guest, a sleep expert, Dr. Edwards.
Hello, everyone. Dr. Edwards here. Sleep advocate, caffeine enthusiast, and healthcare realist. Let's talk about strategies that actually work for people with demanding schedules. Tip 1. Schedule strategic naps. A 20-30-minute nap before a night shift reduces fatigue and improves performance by up to 34%. Tip 2. Use light as a tool. Bright light during shifts keeps you alert. Dim light and minimal screen exposure after shifts tell your brain it's time to unwind. Tip 3. Protect post-shift sleep. Blackout curtains, earplugs, a cool room, and phone on silent. Daytime sleep is fragile. Protect it. Tip 4. Time. Your caffeine. Use it early in your shift, never at the end. Avoid caffeine within 6 hours of intended sleep. Tip 5. Build a simple wind down routine. Even 10 minutes of stretching, breathing, or a warm shower helps your brain switch out of clinical mode. Remember, rest isn't a weakness, it's a clinical tool.
Thank you, Dr. Edwards, for that insight. Okay, so we're coming to a close today. As healthcare professionals and students, we are taught to push through exhaustion, to stay for one more patient, finish one more chart, study one more chapter. We celebrate resilience, grit, and dedication. But somewhere along the way, we learn to ignore one of the most important foundations of our ability to care, our own physiological limits. Sleep is not a sign of weakness, it is a biological repair system. Every hour we sleep, our body is restoring energy, recalibrating hormones, repairing tissues, strengthening memory, enhancing our emotional stability, and sharpening our cognitive performance. And for those of us in healthcare, These aren't just personal benefits, they're professional necessities. Because our patients deserve clinicians who can think clearly, respond quickly, reason ethically, and practice with empathy. We deserve to show up each day as our best selves, not the version running on fumes because we've been taught to ignore our own needs. For students, sleep helps you retain what you study, perform better on exams, and build the clinical judgment you'll need throughout your career. For practicing physicians, sleep protects your health, your decision making, and your long term ability to keep doing the work you love. And for all of us, sleep is an ethical commitment to ourselves, our patients, and our professions. So I encourage you, not just tonight, but moving forward, to view sleep the same way you view any vital sign. If a patient came in dehydrated, exhausted, and struggling to think clearly, you would intervene. Why do we allow ourselves to operate that way? It's time to normalize rest, to prioritize recovery, to acknowledge that caring for others requires caring for ourselves with the same level of seriousness. Sleep is not an option, it's not a luxury. It's a fundamental component of safe, competent, compassionate healthcare. Thank you for taking the time with me tonight. And as you continue education and your clinical journey, I hope you permit yourself, not just tonight, but every night, to rest with purpose. Again, have a great night, guys. Bye bye.